When should I have a blepharoplasty, or when should I get this done? And there's no such thing as a preventative blepharoplasty. So if you don't have extra skin, or you don't have sagginess or puffiness, there's nothing that you need to have done. If you have extra skin, if you've got puffiness or puffy of the upper lid, or puffiness in your lower lid as a result of pockets of fat that are starting to bulge forward, and that can happen as you age. Sometimes people have that when they're very young. If you have it, then there's a potential for discussion around how that can be managed. If you have fat pockets alone and you're fairly young, we would just take the fat out. If you've got deep tear troughs, the fat would be repositioned into those tear troughs. But if you have loose skin or loose muscle, you probably are going to benefit most, particularly with the lower lids, by having a small incision and a very, very precise and conservative amount of skin removal and muscle suspension. For the upper lids, you pretty much always have to take skin out. There's not really a situation where you would not remove extra skin in the upper eyelids. But those things are happening to patients at various ages. I'll see patients as young as in their 20s for fat removal. I'll see patients as young as 20 for fat removal from the lower lids, but it's much less common to need to do upper lid surgery in someone that age. It's more common in the 50s and 60s for people to have extra skin in the upper lids. Sometimes it's not extra skin at all. Sometimes it's just that the brows are starting to fall. I'll sometimes see that after Botox treatments. If people have a little bit too much Botox in the forehead, the brows tend to fall a little bit, and they'll come and see me. That doesn't require treatment at all. That just let the Botox wear off, the brows will go back to where they were, and you don't really need to do anything about that at all. So it really varies. As I said, there's no such thing as a preventative blepharoplasty. You do it when you feel you need it. I'm more than happy to review photos when patients send those in and give somebody a very quick recommendation for, well, you're probably not something I would recommend, or yes, you are a candidate. And if you want to come in and have a consult around that, I'm happy to see you.